Hi, I'm Dr. Rajam Murali. I'm a senior consultant at GarbhaGudi IVF Center, Hanumanthanagar. Today we are going to discuss what intrauterine insemination or IUI is. Intrauterine insemination is a very simple procedure where the husband's sperms are processed and their motility is increased and they are kept into the wife's uterus at the time of ovulation to increase the pregnancy. So, who requires IUI or intrauterine insemination? So, the most common indication for intrauterine insemination is mild male factor infertility. When there is less count or less motility, IUI is recommended. Also, in cases of ovulatory disorders like polycystic ovarian syndrome, mild endometriosis, IUI is recommended. Also, in cases of physical inability to have intercourse like vaginismus, ejaculatory or erectile dysfunctions also, IUI is recommended. IUI also can be done in cases of azoospermia where donor sperm IUI is recommended. What are the prerequisites for an IUI? So, you need to have a good ovarian reserve and both the fallopian tubes should be opened and the male factor infertility should be a mild male factor infertility and there should be no infection in the pelvis. Suppose if you have all these conditions, you are recommended an IUI procedure. How many IUIs are recommended? Up to 3 IUIs are recommended in a couple. After 3 IUIs, if the pregnancy is not happening, you have to move on to the next level of treatment, which is an IVF or ICSI. And when do you not suggest an IUI? In which patients IUI is not recommended is in severe male factor infertility, severe endometriosis, when both the fallopian tubes are blocked, or when there is a pelvic infection. We do not recommend IUI in such patients, and we do not recommend IUI after the 3rd cycle of IUI also. We ask them to go for an IVF, which is more cost effective and more successful than an IUI procedure. So the success rates of an IUI, it depends on the age of the female, the sperm count, the motility, also on other medical conditions like whether they have diabetes, hypertension, thyroid issues. Suppose if they are married for less number of years and they are a young couple, IUI works better in them. The maximum success rates are around 20%. And if 3 cycles of IUI has failed, you have to move forward to IVF ICSI. Thank you.